students. Today, you're going to learn about the functions, or we can say the responsibilities of psychiatric nurses in various settings. The other day, I have told you about the roles of psychiatric nurse, the contemporary role of a nurse, as well as the expanded role of the nurse. So, based on the roles of the nurse, she will be put in the particular setting to carry out her responsibilities. Today, you're going to learn about the functions of psychiatric nurse in various settings. Okay, so as you know, we can, as a nurse, we can work in various settings, like it can be in an inpatient department or outpatient department, or in a hospice care center, or also we can work in a psychotherapeutic center. So, based on the setting where we are placed, the psychiatric nurse has got the various responsibilities to carry out. So, we'll see each of it in detail. So, the first setting where a psychiatric nurse can work is the inpatient setting. Right? So, in the inpatient psychiatric ward, what is the responsibilities of the psychiatric nurse? First thing is to see to it that the environment of the client is safe. That means that we have to provide the environment, including protecting the client and others from the injury. So, you know very well, when there is a patient with the abnormal behavior, there are at times very, very important to maintain the environment or to protect the client's environment. Say, for example, there is a patient with depression, okay, then his environment should be free from all the sharp instruments or ropes or any kind of an instrument wherein he can use it anytime to harm himself. So such kind of protection that we have to give to the client, right? Or say, for example, there is a patient with aggressive behavior. So even in those cases, the environment should be very much taken care of to protect the client as well as the other clients. We shouldn't keep any kind of materials or any kind of equipments which are, wherein the patient can destroy or can harm himself as well as the other person. So very, very important to, as a nurse who is working in an inpatient psychiatric ward, to protect the client from the injuries. So we have to keep the environment free from the hazardous objects. So that is how we have to maintain the safety of the environment. The second responsibility of a psychiatric nurse in an inpatient ward is to perform the psychosocial higher risk and physical assessment. So we have to do the assessment, very, very important, since we are dealing with the emotions and the behavior of the client. We have to do the assessment regularly to find out if the patient is having any kind of an improvement or is condition worsening. So very important to do the psychosocial assessment, to do the high risk assessment as well as the physical assessment to find out if there are any kind of the physical disorders for the client. Also, next thing is to promote the self-care activities for the client. So how do we promote the self-care activities? Who are not able to take care of their own self. The self-care activities, it can be the personal hygiene, or it can be, the grooming part of it. So many clients in a psychiatric ward neglect those, basic activities that they have to perform. So as a psychiatric nurse, we have to educate, you have to give the psychoeducation as well as assist the client to perform the activities, right? The self-care activities as much as possible. You motivate the client, you educate the client to carry out their self-care activity, and at times it becomes necessary that we have to assist them in their self-care activity. It can be related to personal hygiene care, right? Like brushing or taking bath, cutting their nails, or the hair hygiene, it can be all. So all such things that you have to take care when you're there in an inpatient psychiatric ward, right? So how do you manage the medication? There are many clients in a particular psychiatric ward, so it can be a male psychiatric ward or a female psychiatric ward. So child center, we have to work even in the child and adolescent setting. So everywhere it's very common that they may be prescribed the psychotropic drugs. So it becomes very much necessary that we have to give the medication. So administration of medication, so we have to see to it that the medication tray is kept in a separate area, locked, and not accessible to the client, right? And also when they are taking medication, so we keep the drugs in a particular box, and we keep it labeled. Okay, we label their name with the medications and frequency when they have to take the medication. So once they have completed their a meal, they have to come to the nurse's station or to a medication room wherein they be coming, and we have to be in a place to see to it that the patient swallows the medication under the supervision of the nurse. So the medication management is also one of the very important responsibility of a psychiatric nurse. Not only administering the medication, you have to see to it that the patient develops any kind of adverse effects, any kind of an emergency reaction, or any kind of allergy or anything the patient develops. You have to monitor the medication side effects. Yes. So the next responsibility is assisting in the somatic therapy. So how do you assist in the somatic therapy? When I say the somatic therapy, it is related to the electroconvulsive therapy. So when the patient is on the electroconvulsive therapy, it is very, very important. Nurse is there with the patient in terms of the pre-ECT care, okay, post-ECT care or intra-ECT care. During the ECT, what are the responsibility of the nurses? So before the ECT, you have to see to it that you take an informed consent, you inform or give a psychoeducation to the client as well as family about the ECT. What are those effects after the ECT? How they have to be prepared for the ECT. So all those information or the care that you have to deliver to the client with ECT. Before ECT, during the ECT, you have to observe the behavior of the vitals. You have to monitor. You have to be with the client, and you have to see to it that the ECT procedure is carried out. And after the ECT, also it is the responsibility of a nurse to monitor their vitals and see to it the patient gets back his, his consciousness and is oriented to the ward and to the people. So these are some of the responsibilities when it comes to assisting in the somatic therapy. Very, very important to be there with the client. Accurately observing and documenting the patient's behavior. So throughout your time when you're there in an inpatient psychiatric ward, you have to monitor the client's behavior. So we have in the inpatient department, there are many disorders. There are many clients with different disorders. Can be personality disorders or manic disorders, depressive disorder or schizophrenia or psychotic disorders. So alcohol dependent syndrome. So all the disorders are there. So as a nurse, very much important that you are there with the patient, not only being there, you have to communicate to the patients and see to the behavior of the patient, whether it has changed or whether what are those behavioral changes that you can observe in the patient, so that you can communicate to the psychiatrist when he comes, and you can do your assessment and communicate to the psychiatrist, and so they will be able to analyze, because nurse is the one who is there with the patient for a longer period of time. Unlike the psychiatrist, they come, prescribe the medications and move on. But as a nurse, you are there with the patient 24/7. As a nurse, it's important to analyze and note the behavior of the client, right? Documentation of the behavior. Next thing is providing opportunity for the client to make his own decision and to assume the responsibilities for his life. As a nurse, you also act as a counselor. You see to it that you motivate the client. You give some, at times you give the client to make their decisions, right? Which will in turn make him to be motivated, right? So all such activities that you have to carry out and see to it that the patient can lead his life to some extent. So the basic a basic level of care or the personal care that he can take care, at least that he should be able to take care of himself. So such kind of the responsibilities that you have to see to it that the client will develop when you're giving the care in a inpatient psychiatric ward. So next thing is the participation in various therapies. So as a nurse, you're there with the patient, you know what is the condition, you will be taking the patient to various therapies. It can be psychotherapy, it can be family therapy or group therapy, or it can be play therapy or any kind of a therapy that the client is suggested for. So you take the client to the and participate with the psychotherapist for interacting with the patient. It can be a formal or informal group situations, or it can be a role play or anything. Behalf of the patient, you are there to support the patient and carry out the therapy. So that is another important responsibility, to assist the client in various psychotherapies. Delivering psychoeducation is another important responsibility according to the condition of the client. So you will be delivering the education to the client as well as his family. Very, very important, the psychoeducation. Next is the counseling of the patient, right? As a nurse, it is our responsibility to counsel the client as well as the family members. The next one is coordinating with the other professionals in various aspects of patient care, thereby facilitating an interdisciplinary approach of care. So it is important when you take a psychiatric setup, it's not only the the nurse, psychiatric nurse who is working. You have got the other disciplines, other professionals who are working together. So it can be a psychiatrist, or it can be a psychotherapist, or activity therapist, occupational therapist, social worker. So all of them together, they collaborate and they cooperate with each other, they communicate with each other, they have that interpersonal relationship so that they will deliver the quality care to the patient. So as a nurse, it's very much important that she coordinates her work with the other health professionals. Then teaching the social skills and stress management strategies to the client. So the social skill is very, very important, since many of those clients who are neglected by the society or their family members or their significant others. So it is important the social skill of the client should be developed. So they can be placed in a group with the other patients. They can be given the taught how to socialize with the other clients. So socialization skills can be taught to the patient, as well as the stress management techniques. There are varieties of stress. There are various stress management techniques. So it is important to teach the client the various stress management techniques. Discharge planning and community referral is also another responsibility. So when the patient is for discharge, you have to see to it that the client as well as the family, they are educated about the medication regimen or about the behavior what the client will exhibit after going home, what kind of a support or helping hand the family members can give to the client. So all such discharge planning procedures that a nurse should carry out, and also the community referral to be done. Okay. The next one is supervise the work of the other subordinates. So if you're a nurse manager, it's important that you supervise your juniors, you supervise your junior staff nurses who are working in a psychiatric ward. So they are not used to how to care for a psychiatric client. So it becomes important, if you're a nurse manager, supervise the work of the other subordinates. Maintain the ward cleanliness. See to it that in a psychiatric ward, very, very important to maintain the cleanliness of the ward. Since the patient there are having the abnormal behavior, you cannot blame them if they keep their environment in an untidy manner. So it's very much important that you have got the cleaning staffs to clean the particular environment, so that the accidental falls or injuries can be avoided, and also it should become a pleasant environment for the. As a nurse, when you're working in a psychiatric inpatient department, you have to see to it the environment of the client as well as the client and around him, the social as well as the client's care is very, very important to be noted. So this is the responsibilities or the functions of the nurse in the inpatient department. So the next one is the functions of the nurse in psychiatric outpatient department. So first thing what you will be doing here is you are going to do the clinical assessment or the physical examination you're going to do. Second thing, you're going to do a psychometric assessment. So you're going to do the mental status examination to assess the mental state of the client. Assisting or providing psychotherapy to the clients or the behavioral therapy. So you will be working with the you will be working with the psychotherapist in giving the psychotherapy for the client or the behavioral therapy. Any kind of a therapy, you will be assisting the psychotherapist in giving the therapy. Next is counseling the client as well as the family members. She works as a nurse counselor, who will be counseling the client as well as the family members. So she'll be conducting group therapy. So she finds out the clients who are suffering with the same conditions. So she will make them as a group and she will be conducting the group therapy to such kind of the clients, wherein there will be suggestions. They'll be sharing their viewpoints, how they overcome their disorder. So they will be supporting each other in a group therapy, and not only that, they will be developing the social skills. Delivering psychoeducation is another important responsibility of a nurse in the outpatient department. She will be giving the education to the client as well as the family. So these are some of the responsibilities as a nurse in the outpatient department. So moving on to the next, which is the ECT treatment setting. So if you take a ECT treatment setting, I told you ECT is a somatic therapy. So during that time, he will be kept in the ECT treatment room. Okay, so what is the responsibility of the nurse when the patient is there for the ECT? Right, teaching the client prior to the ECT treatment. So what you will be teaching the patient? You'll be teaching that that there's going to be a procedure that will be done on you to bring about changes in your behavior, or you have to educate the client. You have to educate the client about the pre-ECT care. It can be shampooing the hair, or it can be related to removing the jewels, dangers, lenses, or preparing them for the ECT treatment physically. Right, so all these things, teaching that you will be giving to the client, and also about the side effects of the ECT or post ECT, how the room will be, or how that he should be, how that he will be. Post ECT, what kind of behavior that we can observe. So all these orientation that you have to give to the client, education. Right. Next is preparing the client for the ECT, providing care during the procedure. So during the procedure, what is the care that you can give to the client? So even in that process, that the nurse is there, assisting with the post-treatment after ECT. You have to monitor the vital signs. You have to orient the client to the surroundings. You have to see to the behavior of the client. You have to educate the client if he experiences any kind of a difficulty that he has to communicate. So all such things that you will be assisting in the post-ECT care. Then providing reassurance to reduce the anxiety. If there are clients who are going to get the ECT for the first time, maybe it is very much difficult for them. They'll be very anxious. Not only the client, even the family, they'll be very anxious about the procedure. So as a nurse, when you are there, you have to reassure them, educate them that this is a procedure for the treatment, not to panic. There are many conditions, patients who have undergone this particular treatment who are feeling better. So reassure them with the positivity that that will help them to reduce their anxiety. Delivering psychoeducation regarding the ECT. So regarding the ECT, you have to educate the client as well as the family members what is the whole procedure of the ECT. So this is the responsibility of a nurse when she is working in a ECT setup. So next thing is in the psychotherapy unit. So what is the responsibility of the nurse in a psychotherapy unit? The nurse who possesses a master's degree in the psychiatric nursing and is certified as clinical nurse specialist can conduct the psychotherapy to the clients. It can be the individual psychotherapy or the group psychotherapy. So any nurse who has completed a certification course in the field of the psychiatric nursing, master's degree in psychiatric nurse, have certified clinical nurse specialists. They can work in the psychotherapy unit where they will be doing the individual or the group psychotherapy to the client. A therapeutic relationship with the client. So it's very, very important. The first step when you communicate with the patient, you see to it that the patient develops a trust, the patient is, you develop the rapport with the patient so that the relationship is built. So once the therapeutic relationship is built, only then it is going to help you in the psychotherapy, wherein the client will be able to communicate or ventilate all his ideas or the feelings. Second thing is providing the opportunity for the client to release the tensions as problems are discussed. As in when he is trying to ventilate his feelings or his ideas. So it is important that as a nurse you give the opportunity to the client to release all his tension. So being very attentive, being a good listener is very, very important if you are going to work in the psychotherapeutic unit. So you have to give him the opportunity to express or to let out all his tension. So at times when he is talking or when he is communicating, he may express his emotions. So all these things will help him to ease his tension. So as a nurse, you have to give him the opportunity to let out his tensions. By letting out his tensions, assisting the patient in gaining insight about the problem. Very important. You have to analyze that the patient has understood that he is having a particular mental problem or not. Okay, so as a nurse, you have to be in a place when you're working in a psychotherapeutic unit to see to it that the patient has insight or the awareness about his condition. When you go to a clinical setup, okay, so when you go to a clinical setup, you can see there are many clients who know about their condition very well, right? So they know more than us. They know better about their condition, why they are there in the hospital, what kind of problem they are having, what are the experiencing. So all these things they know very well, more than us. Okay, they know very well than us about the condition. So very important as a nurse that you have to bring out the awareness about the condition to for the client. Providing opportunity to practice new skills. So it is important that when a client is doing something good, as a nurse, you have to recognize that a new skill and also teach them, okay, how to go about and motivate them about their skills. It can be related to cooking, or it can be related to cleaning or tidying up things. So such things, when the client is learning, okay, it is important that you give them the opportunity and motivate them to do so. Reinforcing appropriate behavior as it occurs. So you have to give the positive reinforcement to the client when the behavior of the client is accepted, or we can say when it shows a very good behavior, you have to appreciate the client and give him some token so that he will practice such kind of accepted behavior more, right? So you have to recognize that and give the reinforcement for the appropriate behavior. Providing consistent emotional support. So you're there with the client in the psychotherapeutic unit. So consistently the patient can come for the therapy. So you have to be in a place to support the client emotionally and see to it that there are changes in the client's behavior. So this is about the responsibility of the nurse in the psychotherapeutic unit. Next, we are going to learn the responsibilities of the nurse in the daycare or the day hospitals. In daycare programs, the patient will return home at night. So only during the day, okay, the patient will be brought to a psychiatric setup. they will be put in the psychiatric center. They'll be going back to their home by evening or by night. So in that setup is called as daycare centers or day hospitals for psychiatric care, right? So here, what is the responsibility of the nurse? Performing the clinical assessment, accurately observing and documenting the client's behavior. So here also you will be doing the same of observing the client's behavior as well as documenting the behavior, how he's interacting with the other people, how he is practicing his social skills, or what are the behaviors that he is exhibiting. So all such things that you will be observing as well as documenting, right? Medication management, since the patient are there during the daytime in the daycare centers, any kind of medications that you are supposed to give during the day, so that medication regimen that you will be carrying out as a nurse, teaching the social skills to socialize with the client, to socialize with the other people, and also counseling the patient as well as the family members. Delivering the psycho education, again you will be giving the education about the condition to the client as well as the family members, providing the occupational and recreational therapy and vocational assistance. So it's a very, very important thing which is happening in the daycare centers. So here you will be giving the opportunities to the for the client to carry out the occupations to their level, according to their level. So what kind of activities that they can carry out? For example, if the client is sent to a rehabilitation daycare center, so there they will be teaching the client such skills, okay, according to the condition or the capacity of the client. They'll be teaching the client the various occupations or training in the vocations will be given. It can be basic things like candle making or basket making, art, craft, according to the interest of the client, or some computer training, or it can be related to working with the leather goods. So such kind of vocations will be taught in the rehabilitation centers. They'll be put in such department to work, and they will be given an amount for the and they will be given the salary for the client. So according to the capacity of the client and interest of the client, so they will be putting the client to various vocational training, and they will providing the occupational facility to the client. And also during that time the recreational activities also will be carried out. So it can be like the patient comes in the morning, so he'll be put to for some exercises or yoga, meditation classes, or some recreational activities that he will be given an opportunity to attend such activities. So once that activity is completed, then he can move on to his area of interest. He can get trained and he can be put in a particular setup. So such kind of the things will be done in the daycare centers. Is the child psychiatric ward. So in the child psychiatric ward, it is the children who are there. So very important as a psychiatric nurse, when you are there working in a child psychiatric ward, what are the responsibilities? So in the child care center, you will be assessing for biological and psychological need of the client. So you will be doing the assessment again. So you will be doing the physical assessment, the biological assessment, as well as the psychological assessment to find out the mental state of the client. You will be determining the client's strengths and abilities and will develop a care plan to maintain and enhance the capabilities. So as a nurse, you are there, you will be observing or you will be noting down what are the strengths and weaknesses of the clients. The strengths and abilities, capabilities of the client that you will be observing, and based on their capabilities, you can give them the activities. You will be monitoring the child's developmental level and will initiate the supportive interventions such as the speech, language, or the occupational skill. So you will be doing the the developmental assessment based on the development of the child. So what are the milestones which the child has not developed? So based on that, based on the need of the client or need of the child, you will be giving the opportunities for the child to attend the interventions. It can be related to the speech or language or any kind of occupational skills. So based on the need of the child, you will be putting them for such kind of the training. Providing a safe therapeutic environment, including the protecting the client and others from the injury. So it is important when there is a child in a psychiatric setup, the child psychiatric ward, to protect the child's environment from all kind of hazardous injury. Next is cooperating with the other professionals in interdisciplinary approach of care. So it can be the psychotherapist there, or it can be the activity therapist, the speech therapist. Okay, as a nurse, you will be collaborating with others, you will be coordinating the work with the other health professionals. Providing adequate environmental stimulation. So when children are there in a particular setup, the child psychiatric ward, the environment should be such that it should be very much pleasing to the child, so that he will listen and he will also be a part in that particular setup. He will be able to explore, and also he will be able to be interested to be an important person in the particular area. So the environment, you can see a child psychiatric ward, it's very colorful. There will be lot of play equipments for the child, and also the health personnel who works with the such kind of conditions will also should also be very jovial to the client, right? So the environment stimulation should is a very important thing in the child psychiatric ward. Teach the client the adaptive skills such as eating, dressing, grooming, and toileting. Certain skills that should be taught to the client, it can be related to the eating, the grooming, or it can be the dressing and the toileting. So all such skills that the child is required to learn should be taught in the child psychiatric ward. Demonstrate and help the child to practice the self-care skills. It is the responsibility of the nurse to demonstrate the skills. It can be brushing the teeth, the basic thing, brushing the teeth. So as a nurse, you are there to demonstrate this skill to the children. So you're not only giving them the education how to do it, but practically when it comes, you have to do the demonstration to the client, and also motivate them to practice the self-care skills. Provide genetic counseling if necessary, so they will get a chance to understand things, right? So also we have to deliver the psychoeducation and medication management. Provide emotional support to the parents. So parents are there, very very important that you have to give the emotional support to the parents as well. Participates in various therapies like behavior therapy, play therapy, expressive therapies, and bibliotherapy. So the children, they will be given various therapies by the therapist again. So you have to be there, observe the client's child's behavior, and be with the client and assist the psychotherapists in various therapies. So this is the thing which is happening in a child psychiatric setting. Moving on to the home setting. So at home setting, what is the responsibility of the nurse? Assessment of the symptoms, the psychometric assessment that will be done, teaching the patient as well as the client regarding the nutrition, exercises, hygiene, and relationship with the physical and emotional health. So you will be teaching the basic things like what should be the nutrition, importance of nutrition, the exercise, as well as the hygiene. And very, very important thing, how to maintain the relationship between each other. So that will be taught in the home setting. Stress management techniques will be taught to the client as well as the family members, because both of them are in the same place of getting stress. So you'll be teaching the stress management techniques. Daily living skills will be taught, like basic money management skills. So how they have to manage the money. So a client is going to a particular shop. So how much amount of money that they have to spend, how much they have to calculate the money, spend the particular money. So such skills will be taught to the client. So, for example, it can be bank accounts, managing the bank accounts. So, how to go withdraw the money from the bank, how to deposit the money in the bank, how to manage the rent or the utility bills, use of telephones and grocery shopping. So, all such basic skills will be taught to the client in the home setup. And also, the administration of parental injections can be done even at home settings. Venipuncture for the venipuncture for the laboratory analysis or any kind of investigation, if it is needed in the home setting, also it can be done. Medication management, which can be related to monitoring the blood levels, signs and symptoms of overdose or toxicity, teaching on dosages, the side effects and the purpose. Very, very important, completely about the medication. You have to teach to the client as well as the families. What kind of a medication, what are the side effects of the medication, if it is overdose, what is the complications that can happen, what are the signs and symptoms, how to monitor the blood levels and go for investigation. So what is the purpose of, or what is the importance of the medication, everything will be taught to the client. And act as a case manager and coordinate an array of services that include the physical therapy, occupational therapy, social work and community services. So all these areas, you have to work as case managers in all these areas, so that the client will be benefited. Appropriate referrals to community agencies can be done if the patient or the family aspiring for such community support or help. So referral services to the agencies can also be done. Provide supportive counseling and brief psychotherapy, promotion of mental health and prevention of mental illness. So all these things can be done. How to promote the mental health as well as the prevention of mental illness. So that is the responsibility of a nurse in the home setting. Moving on to the community mental health centers. So in the community mental health centers, we have got specialized nurses who are community mental health nurses. What are the functions of the community mental health nurses? To identify the patients in the community. So when the nurse goes to a community, she has to identify house to house. She has to go and find out the cases. She has to identify the cases in the community and also refer such clients to the appropriate hospital. So if she feels that it is very important that the client requires to be given the treatment, she has to refer the client to the appropriate psychiatric hospitals. Home visiting and providing direct care to the patient in the community. So frequent home visiting should be done, and also providing the direct care to the client in terms of the basic care, it can be, or in terms of psychoeducation. So all such things can be given to the client in the community setup. Follow-up care services with special emphasis on medication program, improvement made, as well as the side effects, the patient occupational function, all such things should be followed, right? So all such areas you have to follow up the cases. And once they have been referred to the psychiatric hospital, it's important the community health nurse should do the follow-up related to the medication program, whether they're taking the medications appropriately or following the medication regimen, whether there is an improvement in the condition, or what is there any kind of a side effects. So what are the changes in the occupational area of the client. So all such things that she has to do the follow-up. Then continuing public awareness programs to remove the misconceptions regarding the mental disorders. Very, very important when you go to a community setup, especially if you go to a rural setup where there are a lot of misconceptions related to the mental disorder. So as a nurse, it's her responsibilities to conduct the programs in the community health centers, in the community area about the misconceptions related to the mental illness, and give them the awareness that they have to take such kind of a mental disorder, such kind of a client to the mental hospital or a psychiatric hospital for the treatment. Training the paraprofessionals like community leaders, school teachers, other caregiving professionals in the community. So she also has to take up the role of training the other members in the community, like it can be a school health nurse or community leaders. Okay, in the particular community there will be some leaders or social workers, right? So she has to train them also about this mental disorders, right? Then management of the resources planning and coordination. So management of the various resources or materials as well as coordinating in a particular area or a community is another responsibility. Direct services like caring for the family at risk, abuse and dysfunction, care of homeless mentally ill clients is also important role of a community mental health nurse. So patients who are at risk for violence, or if there's any kind of the abuse, physical, sexual, mental abuses, if they are subjected to such kind of a dysfunction, or if there is a client or if there is a patient who just is wandering in a community area, who is homeless, okay, destitute, who requires mental care. So such kind of people should be identified and they have to be given the services. So that is the responsibility of a community health nurse in a community health setting. Moving on to the hospice care center. So hospice care centers, so here we have got the patients who are terminally ill, who are going to reach the who are going to who are going to end their life journey, right? So who are terminally ill require some kind of a care, mental care, right? So such kind of patients who will be there in the hospice care centers. What is the responsibilities of the nurse? Helping the cancer patients or terminally ill individuals through grieving process. So you have to help. Yes, it is of course they are going to die, but it becomes important that during the process of grief that you are there with the client to support them. So that kind of a responsibility the nurse will have in a hospice care center. Providing the psychotherapy to the client. Supportive psychotherapy should be given to such patients. Provide support groups for families and terminally ill patients. So support groups, it's not only the client who is going to suffer there, but also the family members. So when they come to know that the person or their family member is going to end up soon, so right, family is there under the process of grief. So it is very much important to support the family as well as the client who are in the hospice care center. Next is the emergency department. So what is the responsibility of a nurse? So in the emergency department, we can say the crisis, right? So people who are subjected to any kind of a crisis, who are in the experience of a crisis, so such kind of clients will be put in an emergency center. So crisis intervention programs are very important, especially during the disasters like natural disasters or accidents, unexpected illness causing increased anxiety, stress and immobilization. So such conditions wherein it will cause lot of anxiety, panic attack. So it is important the nurse who works in the emergency care should meet these needs of the client. Next, moving on to the obstetric care center. So in the obstetric care center, as a nurse who is working in the obstetric care center, what is the responsibility? She should be a helping person for the mother who is in the labor, and also be a support person to cope up with the anxiety and stress during labor. So if you take the mother during the labor also, there will be a lot of stress, a lot of anxiety, especially the new mothers who are going to give birth. So it's important that their mental status should be considered, and they also should be given the care during the process of labor. So any kind of a stress or anxiety during the labor should be taken care of by the nurse. Providing support to bereaved patient in event of fetal demise or abortion, birth of an infant with the congenital abnormalities. So if there are clients or mothers who have experienced any kind of miscarriages or death of the fetus, right? The death of the fetus, or there is an infant who is born with a congenital anomalies. So in such cases, the mother is the mind of the mother can be affected, right? She has to be given the support during this period. So important, this obstetrical nurse who is working in an obstetric care unit, so she has to meet these things. Next is a medical inpatient ward. So in the medical inpatient ward, you have got many clients with various medical disorders. It can be related to the Alzheimer's disease or HIV/AIDS, diabetes mellitus, Parkinson's disease, multiple sclerosis, hemophilia, colostomy, amputation. So such conditions will be lifelong. They have to suffer with this conditions. So you can say the chronic disorders. So it is important as a nurse to understand the such clients who are chronically ill, and reduce their stress. So psychological interventions should be given to such cases which are going to chronically affect the client. Next is hospitals for criminal insane, jails and prisoners. So here the role of a forensic psychiatric nurse comes in, right? The forensic nurses will be assisting these kind of prisoners who are there in the psychiatric setup with the self-care, administration of medication, and monitoring the effectiveness of the treatment. So these prisoners who are, we can say psychopaths, right? So they will be taken care by the forensic psychiatric nurses in terms of their treatment, in terms of self-care, and also monitoring the effect of the treatment. They will be promoting the supportive, they will be also helping in promoting the coping skills of such clients. Advanced nurses are able to diagnose and treat the individuals with the psychiatric disorders and are allowed to prescribe the medication. So these nurses who are, advanced, we can say expanded role, advanced practice nurses, they will be able to analyze the client, give the treatment, and also they will be able to prescribe the medications for these individuals, to provide the psychotherapy and act as the consultants for the client. Forensic evaluation for legal safety. So it's important as part of a forensic psychiatric nurse to give the evaluation for the legal purposes. They evaluate the treatment and the effect of the treatment on such clients for the legal purposes. So you have to find out or do the assessment if the client is at risk of causing violence to self as well as others. So you have to do the assessment of the potential for violence. Then parole and probation considerations. When you are there as a forensic nurse, you have to see to it the parole procedure is taken care of. So it is nothing but the leave that you will be giving to the patient to go to their home for some function or some rituals. So during the period of 60 days, you have to take an informed consent from the relative that they will be taking care of the patient about their treatment or any kind of a behavior that they have to manage, and they are responsible for it, right? So any untoward things which happens in terms of the behavior, immediately they have to get the client back to the setup, care center. That is a parole or a probation consideration that can be given. Assessment of racial or cultural factors during the crime. So any such kind of racial discrimination or cultural discrimination because of which the client has committed the crime and he is there in a mentally he is disturbed. So such kind of consideration or things that a psychiatric nurse should know. Sexual predator screening and assessment. So you have to do the assessment of the sexual predator, right? You have to screen them and for any kind of infections or HIV/AIDS, and you also have to do the assessment of such kind of clients. Competency therapy, formal written reports to the court. Very, very important. The legal aspects also should be taken about completely about the condition of the client. You have to document, you have to write it. Formal report should be submitted to the court periodically. So next is review of police report. So frequently, very often you have to review the police report so that it gives you a data how to care for the client, what kind of a behavior that he is exhibiting, everything, what is the crime that he has done, all such things that you can review and you can plan the treatment. So important to review the police reports. Yeah, this is about the role of nurse who can work in the hospitals for criminal insane or jails and the prisoners. Yeah. So this is about the various functions of a psychiatric nurse. According to the setup, the role of or the functions of the psychiatric nurse is differing. So hope you all have understood today's topic. Thank you.